a teeth neurology video series. Let's discuss about multiple sclerosis. Multiple sclerosis is a demyelinating disorder affecting the brain, and the symptoms can be varied depending on the patient. So you can have a multitude of symptoms, very variable. It can cause blurred vision in the eye, cause optic neuritis, numbness anywhere in the body, weakness on one side of the body, bladder dysfunction, severe fatigue, memory issues, balance issues. The different types of multiple sclerosis are as follows. You have clinically isolated syndrome, relapsing remitting MS, which is where the disease fluctuates, it comes and goes. And the relapsing remitting MS often goes into secondary progressive type MS and progressive relapsing MS, where the symptoms come and go, but there's always some symptoms which stay. And that's the secondary progressive MS. And then you have primary progressive MS, which is not that common. And what happens there is the symptoms which come right from the beginning never go. They might fluctuate a little bit, but there's always some symptom right from the beginning, and there's usually a steady decline from the beginning. That's called primary progressive MS. Luckily, not that common, but one has to be aware of it because the medicine to treat primary progressive MS is really, there's only one medicine for that one. How do you make the diagnosis of MS? Through mostly from MRI of the brain, which shows these white matter lesions in a specific pattern, usually around the ventricles, what we call periventricular, and around the corpus callosum of the brain. You can also use lumbar puncture to look for the presence of oligoclonal bands and visual evoked potential. Some people do look at the optic nerve fibers diameter, but those are not as reliable, I would say, as looking at the MR of the brain. And also you can look at MR of the cervical spine and rarely the thoracic spine to make the diagnosis of MS. The treatment now is, we've got lots of treatments just in the last few years which have come. Initially we had what we call the platform therapies, Betason, Avonex, Rebif, and Copaxone. But now we have so many other medications. We have Obagio, which has just become generic, Gilenya, and Tecfidera, and we have intravenous medicines like Tysabri. Ocrevus is also intravenous. And we have subcutaneous injections like Kesimpta, and the S1P class of S1P inhibitors. There are Gilenya and Mayzent and Ponvari and Zeposia and Mavenclad, which has probably been around for a long time outside the United States. So there's a lot of choice of medicines now for MS, and one should work with one's neurologist to find the right medicine for you.